us and support us. Women's healthcare is a woman's issue. It is a must-do issue, and it is a must-change issue. We, the women, have to organize and mobilize while they're out there trying to stop on them. And we need to say there is no option but to have the public option. And we don't want to have a trigger. We don't want a trigger. We don't want our health care shut down. And what is it that we want to do? Well, first of all, for our older people and our older women, we want to make sure that we have Medicare that is stable and secure for health care for all ages and all stages. And we got to save Medicare. For the 47 million people who have no health insurance, they ought to be able to have health care and be able to see a doctor when they need it, and for their children to never have to fear that they cannot have what they need to get their little eyeglasses and their little hearing aids and look and remember DeMonte in Prince George's County, that you ought to be able to see a dentist so that you don't get an infection and have to pass over to the other side there. So we've got to fight. And most of all, we've got to end the punitive practices of the insurance companies. Oh man, I held a hearing on gender discrimination and health care. And guess what? The more I listened, the more I saw that when it comes to the insurance companies, they think that just being a woman is a pre-existing condition. They want to charge us more and they give us less. And when you look at what the pre-existing conditions were, you can't get it if you've had acne. Well, I don't know, but they make my blood boil, so I don't know what that means. Then you can't get it in 8 states if you were a victim of domestic violence. You can't get it if you've had a medically mandated C-section. And then last but not at all least, there was this hearing, in my hearing, a woman from Colorado told me this story, that she'd had a medically mandated C-section. Her one insurance company dropped her, and when she went to apply to another, she was told the only way they would give her insurance is if she had a sterilization. Well, friends, this is in the United States of America. This isn't China. We don't coerce sterilization. This isn't another country that was involved in World War II. So I am meeting with the insurance company tomorrow. So you gotta understand, he's been hiding from me. I've been getting letters from his lawyer. But now we meet. And I'm going to get him to change it. But that's one company. I don't want to do it one company at a time. I want it for all companies all of the time. So friends, we need to pass our So we need to conclude by saying there's no choice but to make sure we can all be pro-choice. And we are going to, as Donna tried so valiantly and so hard in the House of Representatives, we're going to stop Stupak. Stupak will have another name in the United States Senate, but it will still be a shame if we even come close to passing it. We're organizing. All 13 women in the Senate are organizing it, and we will work to defeat it. So I say to you tonight, thank you for your support for electing us. Whatever office we hold, we wouldn't be here without your hard work, your financial contributions, your sweat equity. You are the Maryland Democratic Party. We are the people who work for you. Let us keep our job so we can keep on doing the job that you need needs to be done. God bless you, and sisterhood lives.